during the pandemic. And the topics that we're going to cover, of course, are compliance as it relates to telehealth, but even beyond that, we are going to cover some compliance concerns as it relates to having to do increased communication within your clinic during the pandemic as well. Ali is going to give us some updates on billing in regards to telehealth. And hopefully today you walk away with some ideas to really remain HIPAA compliant in today's environment that's ever changing. And if you have had a breach in compliance, hopefully we can provide you with some solutions of how to manage that. And obviously we're gonna give you those updates with the telehealth billing. There hasn't been much, but we'll give you the updates that we have. One of the things that we are going to offer in today's Zoom chat is 10 very valuable minutes of Daniel's time, and I'll introduce him in a minute. But it's going to be a free consultation on any kind of compliance issue that you might have. So Matthew is going to put that link up in the chat. And if you are interested in meeting with Daniel, and it doesn't necessarily mean like you have to have a problem with anything per se, but just to have a brief consultation with him, you are free to do so. And I do want to introduce our panelists. I've talked a lot about him. Daniel Hirsch is our guest panelist today. He is with HW Analytics. He is the founder of that company. And I'm going to actually let him introduce himself and tell you a little bit about his company. Go ahead, Daniel.
Good afternoon, everybody. So a little bit about myself. I'm a physical therapist. I am licensed in 4 states right now. I come from, this is a second career for me. I come from the property and casualty world where I used to underwrite liquor liability of all things. So a lot of times people ask questions, well, how did you become a physical therapist? And, you know, why would you switch careers from the insurance industry? But oftentimes reading contracts and reading policies, you know, goes very closely in sync with how we operate in the private practice world. So it was kind of a natural blend for me. I worked in every setting in physical therapy except home care. I have not done home care. But otherwise, I've been doing this as a compliance officer for over 6 years now, and as a therapist for over 11. So happy to be on. Thank you, Nicole.
Yeah. Yes, absolutely. And he's super knowledgeable, guys. And he actually brought some questions that he's been having to like rapid fire handle emails all day long, every day. So he shared with us some of the very common questions that are going to be very relevant, as well as peppering in some of the questions that you guys have all had. So we're going to get to those questions in a second. I want to finish introducing the panelists. We have Ali Ferrara, who is our billing manager and has been keeping abreast on the telehealth updates with billing. And then of course we have Brian Gallagher, the man, the myth, the legend.
Stop that.
He is going to be answering some practice management questions. We're going to save those till the end. We're going to field some of those questions as we kind of move through some of the compliance questions as well. So
we're going to do a lot of what we're going to get into at the end is a lot of the Q&A on things that are on the forefront of everyone's mind, just kind of a little bit of a, I got to say, Daniel, when you said you were doing liability for the liquor liability in the future, I thought, my gosh, you know Nicole's family. Wow, that's amazing. Like I didn't know you guys knew each other.
How we're getting through the pandemic.
We're getting through the pandemic. That is like one of the, I think that's the number 2 item on the hottest sales right now is alcohol. So there's some truth there. So we're not advocating for that, everybody. That is not our message here at all. So Daniel's here for liability. He's like, you guys better squash that right. All right, let's go.
So I do want to put up a poll first. So Matthew, I'm going to have you put up a poll because we want to kind of get an idea from you all. What area of compliance do you need the most help with, in terms of guidance? Is it interpreting your Practice Act? Is it email compliance? Is it marketing compliance? Is it quality assurance in regards to documentation? So if you can go ahead and enter your answer there, and then we'll kind of get to those poll results later on in the Zoom chat. So, okay, moving on. We'll talk first about platforms for telehealth services. So Daniel, what platform can I use to provide telehealth services?
Okay, so thank you, Nicole. The platform for telehealth, originally, this is nothing new, right? So as Brian had mentioned in previous webinars, that telehealth is not new to physical therapy. So from a HIPAA compliance, making sure that your platform is secure when it transmits data and information, the idea is that you should not take, and I've heard Brian say this many times, you should not take the quick out just because there's a crisis and emergency right now. Right now, there is a blanket waiver that's been issued that we are allowed to do many different virtual experiences that we normally would not be allowed to do for a platform. But so in this new waiver, the section 1135 of the Social Security Act, it explicitly allows the secretary to authorize use of things like FaceTime, Facebook Messenger, Google Hangouts, Zoom, Skype, which basically what you need to know is that there's no penalty involved because of that from the OCR. So a lot of times when it comes to HIPAA, you're always worried, well, what am I not allowed to do? And in this case, that waiver has been extended to say, yes, you can use other transmissions that you normally would not be allowed. I think it was interesting that a few items were identified, such as TikTok, I'm not actually sure what that is, but Facebook Live. So other things that created issues for, they weren't necessarily private and they were open to the public. Those still are a hard no. They've been identified that they are absolutely not allowed.
Okay, gotcha. Do you recommend, starting with those platforms if you are going to implement telehealth, or is that something that you would recommend going with a more encrypted end-to-end platform?
I would 100% recommend going with an approved, authorized company that has a good track record. There's many of them out there. I've heard different people on this webinar platforms, quote a couple of them. They're all good. If they are HIPAA compliant, you have to make sure that they are. You can simply ask them, and it's not very difficult to do. But in the emergency that we're in right now, like I said, if you have a patient, especially with Medicare population or older population that you have, if they just can't figure out that technology, they can't get on to some portal or something like that, and they only have the cell phone that has, FaceTime, go for it.
Okay, gotcha. Okay.
And Daniel, can I chime in on that? Let's just have a brief little discussion about that. So it is a little bit the Wild West, right? And you just said that the government has issued waivers for the use of multiple digital medias. Did I hear you right that they did allow a waiver for Facebook Live, Skype, FaceTime? Is that correct?
Except Facebook Live. So
except Facebook Live. Okay,
Facebook Live, Twitch, TikTok, those were specifically identified by the OCR to say that's never allowed.
Okay. So I wanted to clarify that. So those are off the charts, but the FaceTime, Skype, Zoom, completely acceptable.
For now, yes.
I just wanted to, I'm going to give it right back to you, Nicole, I swear. I just wanted to get Daniel's opinion because I have mine on this. Oftentimes the government, in my 28 years of doing this, will suggest that we will provide a waiver, and then they go on, which people don't read the following sentences, which will be permissible under particular conditions, okay? And they don't define these conditions. So let's just say, for instance, and I'd love to hear, somebody's using FaceTime, they're feeling all safe and protected because they got a waiver, or it's the Wild West right now. But something horrific happens and it gets broadcasted and someone's child is in the shot, or something personal was said or done, something was used. I mean, we all see Zoom hackers getting into classrooms with kids across the country. This is a huge issue right now for Zoom, honestly. Somebody files a claim. Just because you have the waiver, you still have to defend yourself that you acted in the most prudent, professional manner, even though you may win that at the end of the day because of the curtain covering you of this particular waiver. That doesn't mean you may not still find yourself in a particular situation to have to defend the choices you made. Is that accurate?
Yeah, Brian, that's fair. What the key word is it considered reasonable? So in this case, would it be considered reasonable for a licensed professional to make a judgment call based on the circumstances, right? And right now, once again, we're in an emergency situation, but granted, would it be something that a reasonable professional would make that decision? And that's where your guidance should be coming from. Not that, well, simply there's a waiver, like you said, and we're not going to get penalized. That's not the answer. The answer is just because there's no penalty for noncompliance right now. The proper thing to do is, yes, sign up with an approved HIPAA platform and go to bat, because that's clearly the future.
Yeah, because I look, if this was back in March when everything hit the fan at once and caseloads were dropping like rocks off of a bridge. Hey man, I get it. You whip out, the device you've got, you talk to your patients, you get them to sign what they have to sign, you go to it. But we're in April now. And I don't think there's a single physical therapist amongst 100,000+ physical therapists who think for 1 second outpatient physical therapy is going to go back to being exclusively done within the office. I don't think any of us believe that. So if we all already understand that, we already are swallowing that pill, then honestly, throughout the month of April, you should confront this issue, set it up. This is just me. This is just my opinion talking. Because if I'm going to consult somebody, I'm going to do it for the long haul, for the right thing in the first time. I always feel the lazy work twice. Use the waiver for what you had to do in March, but set yourself up right in April, because if you already believe that telehealth is not going away, that this is the future of physical therapy as it is with all other medical services, then get yourself up and ready and on a platform and protected and doing it in compliance with the standards that are going to come back eventually anyways. So I just want to leave it with that. I'll kick it back to you, Nicole. I didn't want
to. We do have a good question from Allison who wrote in. So do providers who use those platforms need to whip up another consent form to allow use of those platforms? Is that an extra layer of consent that you need to do? And the patients have to sign those, or how does that work?
So the consent's not going to protect you with regard to a breach. So that's just consenting to use the platform or to use that recording capability, which, if you don't want to be recorded, here's your consent. You could hop off right now. But for the question that Allison was asking, no, that's not going to be sufficient. Granted, you should always have a consent form. And right now I'm happy to discuss that later, but for right now, we're going with verbal. So just like verbal orders, we're saying a verbal consent is okay as long as it's documented in the note. So during this crisis.
Sure. Is there any platforms that in particular you're gearing towards? We have a question coming in from Justine. Is it something specific like Doxy or MedBridge, or is it just anyone that is HIPAA compliant?
Honestly, any that is HIPAA compliant, I'm happy about. Okay. Yeah, some of them have more user-friendly features. I've seen some really good platforms out there. If it's whatever your flavor is.
Okay, good. All right, and then the next question: if I can't obtain a signed POC during this crisis, what can I do? So if they can't get a signed plan of care, what course of action can they take?
Right. So once again, we always lean towards Medicare. I don't know why we love Medicare so much. So they made it clear that they have a whole program, patients over paperwork. So this verbal order rule that applies to hospital settings for treating COVID patients, I just wanted to highlight that this logic for verbal orders, consent, verification is all consistent with the overall approach to limiting the contact, right, during this crisis, and a method for treating patients first. So the best practice would be to document, if you can't obtain the signed plan of care, at least, and this goes for post-crisis, same thing. Okay. If you cannot obtain the signed plan of care, you have to show once again, a meaningful attempt, and that would be three different attempts, that you're going to obtain that signed plan of care within 30 days. So that's the gold standard for Medicare.
And Daniel, Nicole, if you don't mind, if I could take a minute of your time.
What if I said, yes, I do mind? No, I'm just kidding. I would never say that.
I would zip it.
Okay, good.
You are the boss.
All right. Go ahead, Brett.
This is your show. So Daniel, I remember, I'm a big fan of Rick Wanda's materials. I think he puts a lot of time, energy, and effort into what he does. He's a busy man. And I think a lot of us have learned several things from his stuff. So not necessarily here to be plugging Rick, but he does do a lot of work and he does have a lot of good content. And so rightly so, he deserves that. I recall being in one of his seminars that said, a signed plan of care can be signed after the fact. And it can be even 10 months later, 8 months later. Medicare cannot hold that against you as long as you can show that you've had the attempts, like you said, to get it signed. And if in fact that becomes an issue, you can send it back to the doctor, even in the date, and just say, this is retroactive to the time in which I took this person under care because I made every attempt to get it signed, but now I got it signed 8 months later. Is that your understanding as well?
Yeah, so that's completely true. So the meaningful attempts have to be documented. That's the key point. So you can't
Right.
just say, I tried, right? So as long as you're keeping a trail in the note saying, faxed over, here's a confirmation. Once again, we can't pull the referring physician or whoever. We can't make them. We can't run after them. We can't go down the hall and track them down anymore.
Yeah.
No. Granted, as direct access and professionals with a doctorate, I think this is a bit outdated anyway, but is something that, yes, that is the standard and that should be applied.
Yeah, well, I just want to mention it because I'm 52 and there's still a lot of us running around that are old, 1990s looking at it. So, but you are correct. A lot has changed. We are direct access in all of our states for the most part, and doctors of physical therapy now. It should not be an issue.
Yeah.
I'm glad we understood that the same. That's good.
And I want to revisit this topic of platforms. It sounds like Julietta is using BlueJay and is having trouble with billing. I don't know if we want to unmic her, and maybe Allie can jump in to help address that question.
I'd like to unmic her because I've heard some things about BlueJay too, and they're not on the plus column. I mean, everything's got its pluses and minuses, right? Everything's got its ups and downs. Yeah. So I'm not sitting here to bash any one particular product or company. That's not the intention. But I do think the reason why people tune into our Zoom chats is because we're not going to sugarcoat things and tell you what you want to hear. We're going to just relay information as we know it. It's not my personal opinion. It's what I'm being told from others that they struggle a little bit. And Daniel even said, be a wise consumer. Each platform's a little different. Shop around. And you know what? If you buy anything, here's my rule of threes. Never buy anything, never hire anyone unless you've done 3 reference checks. 3 reference checks on the plumber, 3 reference checks on the electrician, 3 reference checks on the carpenter. That's half of Nicole's family right there. And then 3 reference checks on any product you buy ever in the country. I mean, I tell people all the time who want to come into Meg Academy or Meg Billing, I'm like, you got to talk to 3 of our people. It's the Amazon effect, right? So when the telehealth platform, shop around, talk to people.
Okay, we might be having some technical difficulties with Allie, so we'll revisit that in her section.
Oh no, I'm here. Sorry.
That's okay. I was just asking, have you had any issues with billing when they use the platform BlueJay?
I honestly am not familiar with BlueJay at all. I was just Googling it actually.
Okay, gotcha. Okay, good.
Good research.
All right, good. On the spot research. That's good. Okay.
Let's ask Allie. Allie, do you believe that billing will be impacted one way or the other depending on the platforms that therapists pick for their offices? Are you under that impression, or pretty much it's just user friendly or not user friendly? Billing's
pretty much it's just user friendly or not user friendly. If you have the right billing staff, then they're gonna know how to bill those claims.
That's what I was thinking. I was hoping you were going to say that. I didn't know what you were going to say, but I think you have I mean, honestly, that's what I love about live. I don't know what you're going to say, but that's my opinion too. If you have a highly trained staff who are adequately trained and highly professional in what they do, whatever product you have, it may be cumbersome on your therapist end, but the billers, I mean, our team of 48 billers, they're just going to grab it, process it. They know what they're looking for. They know how it needs to go out and what shape it needs to be in. It just might be a little bit more work. That's all.
Okay. We have a question from Dan. He's asking, is telehealth something you recommend setting up on your own in terms of compliance and technology, or would you be better served signing up with a company like TelePT Solutions or Agile PT?
Yeah, Daniel. I don't, thanks Dan for the question. I don't think it's that complicated. I think it's, the learning curve is for most of us, most companies were forced to go into this in the last month, right? So since the month of March, everyone just realized, this is the reality. Staff, they're probably going to also realize that, there's different flexibilities now. This may be the new norm where, 2 days a week I'm working from home possibly. And then, 3 days a week, maybe I'm doing evals in the office. So I think it's easy enough. It's not that simple. And to go back to the prior question about BlueJay, I do have some experience with BlueJay as a platform. Their connectivity issues, they sometimes have, they are okay when it comes to the actual quality of the content for the system. However, for billing, you're not tied into, even if you do pick a platform to use for telehealth, you don't have to use them for documentation and billing. You could go back to, if you're using whichever one of the EMR systems that you're using, and just go right back into that system, write up your note, submit, and bill. So the platforms for telehealth like to offer that, but you do not have to use it.
I think that's so great that you pointed that out, because honestly, whether it's Blue Jay, Dixie, or any of these other ones we talk about, and Daniel's painting with a broad brush here, check the connectivity issues, because that is the same kind of feedback I'm getting too. And again, we don't endorse or deny or support or criticize, you know, another group. We're looking out for you and your best interest. And one of the top things that, to find out by checking references is, does this thing drop? Does this thing crash? Does this freeze? Does it have the bandwidth you need? That is a very important point. And you're also right. Go with your EMR system that you like. I mean, you don't have to use the embedded EMR system in that particular platform.
We have a question from Beth, and she said, Doxy allows me to take a photo of a patient performing an exercise to prove that the visit was performed. I heard that a video of exercise performance was required. Is a photo acceptable?
Wow. You know, that's a great question. I have not heard any company requiring a photo, and I do not recommend that. Where is that photo going to be stored? Is that on your personal drive? What's going on? Never recommend, even in the clinic, right? So when you're, let's just say we're doing a gait analysis, you would never use your own phone. You would always take the patient's phone and say, here, let me record you doing a gait analysis. So no, I do not recommend that.
And I also suggest, like, you have all these different therapists. They potentially could be doing this from home. They could be doing it from the clinic, right? They don't have to be under one roof doing it. Who's collecting the signed authorization form, the photo release form? Where's the forms being stored? Are they digital? Are they on paper? Are they printed? So yeah, that does raise some issues. Yeah. I would want to backtrack just 1 second. You know, do you need to do this on your own? Daniel's like, yeah, if you're knowledgeable, you're capable, you're comfortable, set up your own telehealth on your own. But I know from working with thousands of owners, there are the do-it-yourselfers and there are the do-it-for-me's. And I think if you're the do-it-for-me's, because I have a lot going on, go with a tele-PT solutions. Go with a group that's going to take care of it for you, because, and I think Daniel will support this, there are policies and procedures and training protocols and educational things that have to be, the front desk has to be compliant with. So there is a little bit of everybody's got to be on the same page, and everybody kind of has to understand what they're doing there. So if you're not going to be the person who's going to be the stand-up guy, the stand-up gal, and hold responsibility for making sure that everybody's complying with that, then have an outside group come in and do that setup for you. I don't think either one's a right or wrong answer. Look at yourself and look at your nature.
Right, I agree. Okay, moving on. Can I offer a free screen via telehealth?
Thanks, Nicole. So the word free, very tricky. When it comes to providing skilled services and really not charging for something which normally would be a covered service. So while the CDC is making headlines almost every day, right? Back in 2015, they created a balance and fall prevention program, which identified physical therapists as experts who can screen and manage adult mobility, right? That's what we are as therapists. We are movement experts. So fall prevention and wellness is something which every therapist can provide in their local communities. And really, when you craft it correctly, it can provide, you know, a free screen in person or through remote. It doesn't have to be one or the other. It could be both. Really be careful not to assume that you can provide an abbreviated eval. That's really the take-home message. That it's not just a free screen is, hey, by the way, I'm going to do a 10-minute evaluation and cough it up as a free screen. You got to train your staff on what to say and really what those boundaries are to be maintained.
Okay, good. All right, we have a question from.
Are we on the same page with the idea, when you answer that question like that, Daniel, are you under the impression that therapists are asking that question because they're interested in doing a free screen as a way to procure the patient for an eval?
It's another revenue source for going around a referral source. So you're referring patients essentially to yourself by doing a free screen. Yes.
Okay. So, you know, I know one of the things that we talk a lot about with our group and the way we train is, you know, always provide medical necessity, always provide medically relevant intervention, provide skilled care whenever possible. I know we've all walked through that airport and we've seen those free this or that, or these free chiropractic this or that services. I loved it when Daniel hedged on the word free. So I'm going to leave it at that. I'm not a huge fan of free anything, because if you went to school and spent as much time, energy, and effort as I think you did, and as much money and revenue becoming a licensed trained professional as you are, providing a free service just to procure the patient for your paid service is bizarre to me. If I'm going to provide a pro bono service, it's because I'm doing it out of the goodness of my heart, because it's what's relevant for the patient. Whether they become a patient or not is not the point. It's because I can do that for them and it's going to benefit them. Nicole's got ghosts moving like doors in and out of her.
It's a lot of action in here in this household.
You thought you had that thing covered, but you know, with 8 kids, what can you do? So anyways, I'm glad we're on the same page with that, Daniel. I mean, I like providing the screen with the intended product of helping the patient, not so much with the intended product of, you know, reeling somebody in. I don't know. That's just me. Everybody feels a little different.
Yep. Okay. So Allison asked, I had a telehealth visit with my primary doctor, and the only thing he recorded was me acknowledging on record saying, I consent to this visit and to bill my insurance. Can we record them saying that, or is that not necessary, or am I just being obsessive about covering every angle?
Sounds a bit obsessive, but it's smart. It's not necessary. No, you do not have to. You do not have to provide that.
Okay, good. All right, let's move on. I want to save, I see your questions, Ronald and Justine. I'm going to save those a little bit further on for when Allie comes on about billing for Medicare. So I'm going to get to those questions in a minute. But I do want to ask next, if I instruct a parent of a pediatric patient to perform manual therapy, can I bill 97140 during telehealth? Manual therapy code.
Love this question, right? It makes me want to just repeat it out loud that I actually heard this question.
Yeah.
So manual therapy techniques is the official definition for 97140. That's it, manual therapy techniques. So can I justify that my skill technique is so amazing that I could convince a payer to reimburse me for remote manual therapy? Brian, wait for it. So currently, I don't think so. Almost, right. So most payers omit this code for covered telehealth anyway. But just in case somebody was tempted to bill for manual therapy through telehealth, please don't.
Yeah, exactly.
Yes, I love it. I love it. I hear people just bending and twisting. And I'm like, you know, Daniel, we became friends several months ago. And the reason why we're working together and invited you here is because we have the same philosophy. Don't practice in the gray zone, people. It's black or white. Either you look good in orange and black and you like wearing metal around your ankles, or you don't. Don't do stuff in the gray zone. It's what we were saying earlier. You may feel you're protected, but you just open yourself up to interpretation. Just don't do it. It's just not worth it.
Yes. And Dan wrote in and said, Jedi mind tricks are reimbursable. So yeah, I think that just further reiterates that. Okay,
well,
good.
You know, it's a whole chiropractic, throw a bottle of vitamins in your hand and push on your arm. And yes, you are deficient in vitamin D. Let's go on to the next vitamin. And I'm like, okay.
What about some self-mobilization techniques though? Like, what about that?
Well, wouldn't that be self-care? Wouldn't that be 97535?
Yes, you're right. There's no way around it. I don't know. There's no way around it. I don't think you can you can build that. Yeah, I'm with you. Okay, how can I document consent?
Was that a question? Self-care techniques? Is that Daniel?
I just threw it out there. No, I don't think that's.
Yeah, but there's 50 people listening right now.
78.
Well, it depends if you're working from home or just at home. No, I'm kidding. It's not 535 or 537. It's not. It could just be an exercise technique. It could be whatever. But please stay away from the manual for telehealth.
Yeah, stay away from the manual.
I'm with you. Totally. Okay. So my next question was, can I document consent?
So prior to this COVID-19 emergency, really the signed document confirming a patient's consent, or sometimes for a child or guardian, it was either on file or it wasn't. That was it. You either had it or you did not have the consent. And as I mentioned before, simple for a telehealth visit during this time and this time only, the verbal consent could be obtained for each treatment, once again, for each treatment, and documented accordingly. So you can't just say, I got the consent on the eval and then here we go. Each time you log in, you got to say it and you got to record it in your document.
Okay. Do I have to collect a copay anymore since you're treating via telehealth?
You know, that's a great question. Every day there seems to be another answer to that. You know, really payer contracts and insurance companies are updating their policies almost every day. The trick is to try to tell us what they're doing. States they've released different mandates on cost sharing, copay waiving for telehealth visits, but really little clarity has been provided for who bears the burden of the service cost. So if they're waiving it, do I have to eat that, or is it the carrier?
That's a good question.
Most likely it will be the insurance carrier, in my opinion, since not paying insurance premiums for a certain number of days are now being allowed to be postponed. As an example, here in New York, where I live, an emergency regulation for life insurance and property and casualty insurance premiums, you could waive that, and there won't be late fees, and they're not going to report that to the credit bureaus for 90 days. So it seems to be the theme where we're going, but you have to check. Please check your payer, and please contact your state, because oftentimes the states are collecting this information for the therapist.
I'd love to hear Allie's opinion on that, if she's come across that, because I think this raises an important question. If in particular state with a particular carrier, the patient does not have to pay their $25, $30 copay, well, that money was still supposed to be brought in exchange for that service. Where's that going? Is that going to be billed out? Is that going to go into the billing, and we're going to see that in the EOB and in the EFT that's coming in for billing? Or is that something that the insurance company is just going to we're going to tabulate and we're going to bulk bill that after the fact? Does anyone even really know that, Daniel?
They will definitely be figuring this out. No one on either side knows this yet.
Yeah, no one. As far as I know, a lot of insurance companies are going in the way of waiving the patient responsibility for telehealth visits. We have not got any EOBs back stating, how exactly that's going to work, and we're still waiting on clarification on that as well.
So the minute you get an EOB, and you'll see on that EOB, you'll see, CPT code, covered charge, CPT covered charge, and then you'll see one that will not be allocated. And what do you think you expect to see, Ellie? It'll be like, reimbursement for copay. I mean, they're not going to be that descriptive, because heaven forbid. But how are they going to indicate that on an EOB? How are we going to know?
I imagine that we're going to get the EOBs back, and the insurance company is just going to pay it in full. It won't decipher the difference between, they'll just cover the whole visit in full.
Okay.
That's my opinion, what I think they're going to do, but we're still waiting on clarification on that as well.
Well, everybody knows, Allie's husband works for the Centers of Medicare Services, so she's plugged in. There's Fauci, Trump, and then Allie's. Allie, I'm riveted to every word you have to say about this. So that sounds good. It sounds plausible to me. Sounds like a good explanation.
Okay, good. All right. So a question came in. Do you also have to document patient-initiated request for each note? Because I maybe even referenced, I'm assuming, to the e-visit. You can't ask them to initiate treatment. They have to seek you out, or that e-visit. Right. Is that the same for telehealth services?
That's a good question. I'm not 100% sure, just because I'm avoiding at all costs e-visits. I personally do not believe in them. They don't make any sense. As a therapist first, before I'm a compliance officer, I'm not doing my patients any service if I'm just going to put them in a box of a few minutes. So I think that's a good question. I'd have to look into that, though.
Okay. And when you read the definition of the e-visit, take the pandemic out of it, it was intended for somebody who's having trouble at home. They're having problems. Yeah. They're confused. They're not sure. And it's just for you to nudge them through so that they can be compliant and safe and proper in their procedures at home in that environment. It's not intended to be it's not even correlated to the plan of care. I mean, it clearly says that has nothing to do with your plan of care.
Right. And I want to address Justine here, and I'll let you do it, Daniel, but we think we have to be careful with Medicare. But she said, if we can't bill telehealth for Medicare, e-visits seem not worth the time and energy. I'd rather give a free screen or a half-price wellness than bill Medicare for $20. Do we have to be careful with, billing anything to Medicare patients?
It's the question of the day. It really is. As of 2:00 Eastern, CMS got on their fabulous call and just they dropped the ball. They could not answer the question when it came up for PTOT and speech. And they apologized for the confusion. That's not acceptable. For a doctor profession, we're allowed to provide, our services are allowed, but yet the provider's not allowed to provide the service. It doesn't make any sense. So I think the take-home message is, yes, we need to advocate for the profession a little bit better, but at the same time, do what's right. As Brian mentioned earlier, we should not be giving away our services, especially if they're skilled. We do not want to be discounting skilled services. So that's if you take home any information that I'm telling you, please do not give away skilled treatment. If it's just a free consult or a wellness, that is absolutely fine. But if it's considered medically necessary skilled care, that should not be discounted.
Right. Right. I could not agree more. It's just, you have to think about the integrity for yourself and for the people you represent, the profession that you represent. I really think you have to think about that. And again, you're acting in the best interest of the patient. You really are acting in the best interest of the patient, because the minute you start looking like a Walmart bargain level shopper, that's how you're going to be treated.
So if we're not allowed to do telehealth and we don't want to go the route of e-visits, what can we do? Because, I mean, you can't offer cash pay services, can you, to Medicare if they have Medicare? I mean, how does that work?
Great question, right? So if it's a non-covered service, here we go, right? So if it's a non-covered service before this COVID, technically you can. So I think that's the catch-22 that the APTA has put in. They keep saying, well, we're going to have discussions. And as a business owner, you need to make that decision on what you're going to do for your patients. And that's what every business is doing right now. They're having to figure out, well, what is best for my business and for my clients, for, how we're going to look going forward. But as a telehealth non-covered service, yes, you would be allowed as an exception to charge your patient cash. So that's a really good question.
Okay,
yeah,
good.
And I know we have, I don't know if Allie knows of several, but I do know we have several owners around the country that we know of that are just offering this as a cash-based service. This is a non-covered service under Medicare. We are making ourselves available to provide this as a fee-for-service, cash-based service as a non-covered Medicare service.
Yeah. And we're just waiting for them to say it's okay.
We're just waiting.
We've included PT, OTs, and speech therapists in the mix.
And our heart goes out to several of our patients. I mean, we all know patients who've maybe they just had a hip replacement or a total knee. And we know if they don't get some form of intervention, they're going to regress. There's going to be greater complications. Look, people are still having strokes every single week. People are still having heart attacks. People are still having diabetic neuropathy. This stuff hasn't stopped just because we're all in a stay-at-home order. So your ethical judgment has to come to bear here to help your patient not regress and get them in a worse condition, right? So I think you can kind of feel your way through that.
Okay, we have a COVID related question. So if my patient tested positive for COVID-19, what should I do?
So definitely the first thing that you should do is take it seriously, right? This is nothing to just kind of say, it's just another virus. It's kind of like the flu. So take it seriously. If it's a patient or an employee for that matter, that tests positive, you need to act. And really you need to determine what the exposure is. And the key phrase is how much direct extended contact took place. So that means figuring out who either overlapped during that period of time that they were either exposed to that, and really follow medical advice. So the immediate is they should be under the care of a doctor. They should be following those instructions, and that could be with a phone call. They don't want emergency rooms overrun with everyone who tests positive. Also, the 14-day self-monitoring or quarantine should really be strictly followed. Local state health authorities also need to be notified. And really, the staff and patients who may have overlapped with that COVID-19 individual will need to be notified of the exposure and your recommendations for what steps they need to follow.
Okay, very good. What should I do with my MIPS data if I don't submit now?
I'm kidding, don't throw it out. Submission for 19, right? So the deadline had been extended to April, did we just miss it? No, so April 30th, it had been extended. And if you're MIPS eligible and you have not submitted your data by the deadline, you basically qualify for an automatic extreme and uncontrollable circumstance policy, which basically means you're not penalized. So it's considered a neutral year. That's really what it comes down to.
Okay, very good. How do direct supervision requirements apply to these new scenarios?
So when I think of supervision, and all of you who, anytime you're a student, you're always worried, what setting am I in? What state am I in? What supervision is applicable to me? So let's just remember that supervision requirements are defined in each state practice act. So generally speaking, when it comes to telehealth treatment supervision, it would be considered reasonable to interpret everything other than in-person supervision to allow the supervising therapist to just be available. And that doesn't mean, Brian, you got to sit on every single telehealth visit that I'm performing. A supervising therapist would just not need to be on every Skype or everything like that, really. So again, each state has their own standard for supervision, and how often or how accessible that therapist must treat. I'll give you an example. I'm licensed in New Jersey, and a licensed therapist needs to make an on-site visit and actively participate in the treatment once every 6 patient visits, or every 14 days, whichever occurs first. So you got to follow those rules still. But once again, the only caveat is if it's an in-person, then you actually have to be essentially with that occurring visit. But otherwise, you just have to be available.
Okay, good. Denise had a question. How does a therapist determine the price of cash-based telehealth session? How do you determine that?
It's got to be reasonable. You need to know what your market is. So for me in the Northeast, it's very different than the Midwest versus the Southwest. So you have to basically follow Brian's rule of 3. Really make sure that you're doing your research and figuring out what is considered reasonable in your region, just like how Medicare does their audits. It's not a nationwide, hey, by the way, we're going to come after you. You're compared to your peers in your region. So you should know what those regional costs are.
Okay, good.
You make sure you, and you know, I would recommend this too. And Daniel, I'd love to hear your answer on this. I often recommend 3 fee schedules for people. And one is a commercial fee schedule, one is an auto litigation fee schedule, and one is a cash-based services fee schedule. As long as those fee schedules are written in stone, established in your policy and procedure manual, understood by all, because you can't be all over the place, you know, making special arrangements for special folks. That's not appropriate. And if you do the cash-based one, obviously, do it based on time. Do a 30-minute session, 60-minute session. You know, what I've experienced is most people are charging somewhere between $120 to $180 eval. And I've had people charge more in different parts of the country, if you're in Cook County or if you're in Fairfax, Virginia, stuff like that. And then for the revisit, I've seen it from $80 to $120 for a revisit. And again, depending on where you are in the country. So I just wanted to give some people some ballpark numbers of what we've seen. I would have to say the most popular number that I do see is $90 to $100 for a revisit and about $130 to $150 for an eval. So I wanted to give you just some hardcore numbers from somebody who's been in like hundreds of offices across the country. Daniel, have I said anything that you would disagree with there?
Yeah, just be consistent. I think that's really the take home, because they're going to Google, they're going to call the competitor, they're going to know what the customer's going to know too.
Yeah.
And so are you having that thought of like parity where, you know, that's going to be treated the same as like a cash pay, you know, visit that you're in person?
Great question. I want Daniel to answer that first.
Love parity laws. Yes, it should be, in my opinion, it should be. You know, especially if your state allows it 100%, you know, don't devalue your costs. Once again, you know, I'm dealing right now with a lot of therapists have been asking me about Cigna. We're only allowed to bill 97110, 2 units. So what does that mean? That means that I'm only worth 23 minutes to my patient or to you. What does that mean? So they're devaluing that service, and maybe that just restructures the whole concept of maybe now my patient needs me every day instead of twice a week. It's just things to consider based on, well, what is being allowed from a payer contract standpoint versus, you know, from a parity standpoint, you have to know what your time is worth.
Yeah, and as therapists, we can't be hypocrites, right? If we're saying we're going to provide the same level of care, we're going to achieve the same level of outcomes, so we should be paid the same, then you have to be consistent throughout, right? You can't provide a different level of care and expect to be paid in parity. It's all great when you talk to the therapist about, hey, I want to get paid in parity. Well, you have to get the same level of outcomes. You got to get the same level of intervention with your telehealth visit, with your remote visit, as much as you are in your live visit. You can't have one without the other. So that's great. I agree with you 100%. I think that's
okay.
It doesn't have to be the same. Just remember, Brian, once again, we're not billing manual because people love the way we, you know, we operate very well.
Those would be the people I would pull in, right? Those would be the people I'd bring in, right?
Right, but we have other skills. We could also be doing home assessments, and we add other value. So
add other value. That's right. It doesn't. You're right. It doesn't have to be the same unit of touch or whatever it may be. But I still owe it to my patient to find a creative way to get the same level of outcome. You know, I want to give the same product. You know.
Yeah, exactly. We have a couple questions. Karina asked, we are planning to start providing tele-rehab to our patients in the next week. They have Medicare. If Medicare will eventually cover PT services, what are the odds that they're going to retroactively cover? So if they provide services, that they'll backdate to,
Should we get Allie's husband on the phone? Maybe he might know.
Allie, give us the direct line. Stop holding out on us.
That's the kind of question, like, who knows that answer, right? Go ahead, Daniel.
I think
Daniel does.
I don't gamble, but I'm telling you, from a practice and from a profession, it makes zero sense for them not to cover something where our services are allowed, right? So our services are allowed, just not the licensed provider. To me, that doesn't make any sense as a doctorate level professional. But something to consider, you have to make that business decision. If what you're going to do from a billing standpoint, are you going to just hold those claims? Are you still going to go ahead and treat? You have to make that decision.
Okay, and Brian has a question on if you're in network with Blue Cross Blue Shield, but opt to offer telehealth visits on a self-pay only policy rather than billing for services, is that a gray area? Is that like a trouble zone where they're in network with a insurance company, but they're only, doing self-pay for telehealth services?
If your if your carrier that you have a contract with covers that service, you cannot go ahead and breach that contract. No.
Okay, good. Okay, good. He put a caveat here. His reason for asking, our time is worth more than $25 for an e-visit, telehealth visit, but they don't want to, and they don't have to worry about, getting reimbursed retroactively.
More than agreed. Exactly. That's why I have not been paying much attention to e-visit, because it doesn't make any sense.
And that also goes, even before this pandemic. Who asked that question? Brian?
Mm-hmm.
Right. So Brian, even before this pandemic, if you caught my talk at PPS or any of the webinars that I've talked about, the hybrid model, right, where you actually set your practice up in a hybrid models arrangement, because I've been pushing for the last 12 months that physical therapy 2020 cannot look like physical therapy 1995, where you're just trying to make a living on the insurance base only. You have to find a way to get 20% of your revenue in through cash-based services. So one of the ways to do that is set up a hybrid model. Have 2 tax IDs if you're in that New Jersey market, if you're having that struggle. There's certain environments and markets where you don't even need 2 tax IDs. But one corporate, and Daniel knows, if you're in network and your tax ID is attached to that in network, you have to perform and behave and treat the patients in accordance with the contractual terms and regulations that you signed to be a participant in network, to be a provider in network for that carrier. But if you have another tax ID that opts to be out of network, well, now patients can go out of network and possibly you can charge cash, or you can get out of network benefits, or you can go in network. So you can literally divide this out where you can do this all within one office. So there are ways for you to actually evolve your practice so you can professionally, legally, and within proper guidance and rules and regulations, perform both cash-based services to, Cigna patients or Aetna patients, and collect insurance for Cigna Aetna patients with the right structure.
Okay.
So if you want to learn more about that, obviously just call us or just go to info@megbusiness or just reach to Nicole and, go off through our website. I'd be happy to sit down. She'd be happy to sit down and show you, talk to you about that.
Okay, I want to cover a couple breaches in compliance, and the reason being is because there's such a huge amount of information flowing out, to people's patients. We've had more than one client who has reached into us and said, oops, I didn't put blind CC instead of, I actually CC'd everyone. And, what can you do if that situation happens? And what, are you in trouble from a compliance standpoint if something like that happens?
So that's a really common question. It's really easy to do. It's human nature to, especially now, right? So especially now, right now, we're so reactive. We want to fix anything that we accidentally sent something we didn't realize, we didn't blind copy. But the first question you need to figure out was what protected health information was mistakenly sent. So you need to, under the HIPAA breach notification rule, a determination needs to be made what the nature and extent of the PHI involved really included. So the types of identifiers and really the likelihood of re-identification. Then next, you'd basically, where was the authorized disclosures sent? So we need to figure out who exactly received them also. Was it actually acquired? Was it viewed? What was the extent? So basically we're saying you do have to investigate. You have to take time. You can't just say unsend. It doesn't work that way. Maybe if it was through Google, you got, 3 seconds. But since covered entities like yours must only provide the required breach notification if it involves unsecured PHI. So we're talking about something that, once again, it was unsecured. It should be protected. We need to figure out, was it rendered unusable, unreadable, indecipherable to basically people that were unauthorized. So we need to figure out who did it go to. An important part to remember is that a formal process really has to occur, and the documentation trail that you could prove, including a formal breach log, a summary of the occurrence, really has to be filed for reference internally. So don't rely on memory. Don't say, oh yeah, I think I did this. It has to be formally documented. The number of individuals that were impacted really directs the whole result for how you report the breach. So very, very important. That number is critical to determination. If it's over 500, you got to go to the media. No one wants to do that. And finally, the OIG will absolutely want to know how your practice will be educating your staff, really, in order to prevent any future occurrences, including, but nobody likes homework, but mandatory annual compliance training. Training has to be specific to your practice. It can't just be a generic off-the-shelf healthcare video. That doesn't count. So really, this training will complement other established policies and procedures that include HIPAA and OSHA manual. So you can't just say, oh, I did something. I talked to them about it. Has to be documented and it has to be referenced because they have to be updated on an annual basis and really well known to your staff for reference.
And I'd like to put up that, your free consult information again in the chat, Matthew, if you can put that up there, because he's the guy you want to talk to if there is any question about a breach. And again, 10 minutes of his time, as you can see, I mean, he's a wealth of information, is going to be, super valuable to you if you have that question. And then he can better guide you as to what steps you might need to take moving forward.
I mean, we get a lot of those questions. We get a lot of those questions coming into us, Nicole, because we have thousands of owners that we work with, right? And I'm telling you, I'm just sending them right to Daniel because one of the things I sense when the owner calls is they're scared. They're scared, they're full of fear. And when you're scared and you're full of fear, your chances are high that you're going to make matters worse. And so I tell people, don't try to hide it. Don't cover it up. Just go to somebody who's going to bring you the comfort and bring you the certainty that you need so that you can move forward feeling that you're at cause over the situation. You're not the effect of the situation. So for those of you guys watching this recording, please get Daniel's contact information. He will calm your nerves. He will give you the certainty and he will move you to a position of causation over the situation. And chances are, and Daniel, correct me if I'm wrong, but in our conversation, chances are it's usually not as bad as the person's really envisioning. It could be bad, but if you do the right things and you behave in the right manner, chances are you might have something to deal with, but it's not as bad as it could be. Am I correct in that?
Yeah, a lot of times people get wrapped up on these high profile cases that you see, every month. There's another PT getting locked up or a massive fine. And we think, oh no, that's me. If you didn't have intent, where you weren't doing that intentional, there's oftentimes exclusions. There's a lot of times that, you may not need anybody else. You could fix it on your own and have a nice day. And that's really the goal, to make sure that you're approaching it from a very systematic, like Brian was saying, that you're taking the steps instead of just ignoring it and saying, I hope nobody notices.
Yeah, that's not defendable.
Yeah. Okay. So another scenario is, now people have more time on their hands to get caught up on some of the things that we as therapists tend to push to the side, and namely documentation. So we have another question for you of an owner who has about 150 dates of service behind trying to catch up on writing notes. Is there any risk for them to lose their license? Is this, something that, could be a compliance issue?
So great question. Really many issues to look at here, right? So first, the practice of therapy always starts with what your state practice act. I said it a few times already, and I'll circle back to signing the treatment notes, but a licensed therapist should be signing signing patient other forms, like a patient intake form, maybe a medical intake, medical history, medication. Those are all happening before the second visit. So these are things that the therapist should absolutely putting their pen down and signing off. As a licensed therapist, you're really attesting to the skilled services that you're providing, or supervise in the case of a PTA. Also, depending on your state, it's possible that a patient in your facility under direct access would also be required to have a therapist sign maybe an attestation for a notice of advice. So it's likely that the payer contracts will also require a signature. So it's not like, I don't feel like writing my notes today. I'll do them over in summertime. So most EMRs have this built in. So they already have built-in requirements for signatures on your notes, but it's good to check. They're not foolproof. Let's take a step back and say, why would a therapist not sign a treatment note immediately? So as a compliance officer, I'm thinking, okay, you don't want to sign your note. As a student, I have very clear memories of sitting late in the hospital writing my notes. I wasn't allowed to leave until they were completed. So if you're doing this because of either credentialing issues, you need to have a different conversation with your admin and billing team. And really, from a risk management viewpoint, not signing notes it's screaming fraudulent activity. So
let me just reiterate that we are advising that you stay up on your notes. In fact, it's one of our policies in our PMP manual to have your notes done at the very latest by 9 a.m. the next day. So
if you're running your practice and you are not holding your therapist accountable to having Monday's notes in by 9 a.m. Tuesday's notes in by 9 a.m. Wednesday, then you're just deficient in your CEO responsibilities, and you're deficient in the area of confront. You're afraid to confront your own staff. So are you really running that office? Are they running you? And I'll tell you a quick little story about this, and Daniel's answer is 100% spot on. There was a practice I was consulting out in the Midwest, and the husband and wife had the clinic, and the husband it was a nasty divorce that was going on, and he was doing all his hanging out and doing stuff with other people of the other sex, and she was spiteful on it, and she found out he's driving around in his Ford F-150 with 150, 200 notes in the back, charts, because it was not EMR, roaming around, and he got all backlog. She turned him into the state. He got his license suspended for an entire year by running around with all this patient data and not being up with his notes. And there were just several violations. I mean, obviously it was privacy and stuff like that, but there were violations based on your billing for services that you don't have the actual documentation record that substantiates the care that you're saying you delivered that went out in the transmission of billing. That you can't bill for a service that you can't pull a record for that matches what you're saying you did. That was the big thing that got him. So he had fines and he was suspended for a year. And of course, she felt very, I don't know, rewarded, I guess. So she got her vengeance on that. Yeah. But I lived through that with them, and that was serious, but serious stuff. Serious.
I believe it. Okay, we have
that
a question.
Doesn't surprise you, right, Daniel?
Well, it's a red flag.
Yeah.
It's a red flag.
I have a question from Justine. She said, could you repeat the OSHA training that's good for staff? Just read a manual or hire a company? What should you do about, getting the proper training for your staff?
Yeah, so OSHA we tend to forget about because we're not really, most of us in private practice, we don't think about it. We're not JCO certified. We're not doing all this other HR. We're not in that world, but we are 100% in that world right now because of COVID. So we have to have a reference for OSHA training. We should have a OSHA manual as well as a HIPAA manual. And that could be anything with regard to appropriate for your setting training. That's the key take home. So if you're doing an OSHA training and it's talking about hard hats and steel boots, that's not relevant to your practice in outpatient therapy, right? So it just has to be something that you have on file that you can reference to your staff.
Wait a minute, unless you're in Wisconsin.
Well,
I'm wearing steel boots right now.
I'm sure you are. Your back door's wide open. There's going to be a goat or a cow that's going to walk in that door any minute.
These kids were born in a barn, literally.
Yep.
Okay, moving on. Allie, I'm sorry. We're getting to you.
It's okay.
Give us the big Big update on telehealth billing.
Oh, okay. So as of today, I don't have any new updates on a national level for telehealth. I did hear that Blue Cross Blue Shield of Michigan and CareFirst Blue Cross Blue Shield of Maryland both added telehealth codes for physical therapy. So that's a win there. As far as e-visits go, right now, I've had a clinic tell me that they experienced success with billing an e-visit with just the CR modifier, no GP modifier. However, that's contradicting what APTA is telling us. My billing staff did bill a test claim out with just a CR, and we're showing that it's still in process. It hasn't denied yet, which is a good sign. But right now, I have no concrete information on that. Hopefully by, I would say maybe we submitted the test claim last week, and it usually takes about a week and a half maybe for the claim to show paid in Medicare system. So we should know something soon.
Okay, so maybe next week's Zoom chat will have more
an
updated
update
information
on there.
I do have some notes from Dan. He typed in New Jersey, Aetna, Blue Cross Blue Shield, UHC have waived copays as per their emails. And then from Julietta in California, she said it's been approved for Medi-Cal by the governor.
Yeah.
Yes. I believe the governor in California has a state mandate out stating that telehealth has to be covered for physical therapists.
Okay, good. All right.
Wow,
good.
and the governor filed that.
Yeah, the governor filed that.
Wow. That's one of the benefits of billing all over the country is you get to learn from the different states and help the others.
Yes.
So yeah, that's great. I love this strategy you've taken, Allie, of, sending out test claims, here and there, because sometimes, with the way things are, the only way you're going to know is if you try.
Right.
Yep.
Can't really go on what everyone's saying. You can't go on what everyone, there's a lot of fake news out there.
Yeah.
There is a ton.
It's a lot of reactionary stuff right now, it feels like. So we gotta have to test the waters.
Yeah.
Okay, I want to move over to Brian. I don't see any questions coming in particular in regards to telehealth billing, but if you guys have those, let me know. In terms of practice management, we had a couple questions. One of the questions was, is there a formula or guideline to follow for when to bring staff back to full-time status? Now, we've just had this application process start for the PPP. So a lot of people are wondering, like, do I bring everybody back now, so that I can have their paychecks accounted for? So maybe if you can handle that and clarify your take on that, that would be helpful.
Okay, I'm going to do that. I'm going to ask something of the audience first, though, for the benefit of all of us who are listening and including myself. I would like to hear from anybody, if you've been paid, if you've submitted an application for the EIDL, the Emergency Injury Disaster Loan Program through SBA, if you filed the additional application for the advanced payment, the advanced $10,000, that is a grant that will be fully waived. You do not have to pay it back. I would like to hear from anyone who's applied and who has gotten through, they've received funds. Please share that with us on our Facebook page. I will repurpose that in my podcast tomorrow for everyone's benefit. If anybody knows, like, hey, I put an application in, it was going through processing, but you knew how to chase it down, you knew how to nudge it forward, you knew who to call or what email to go to, website to go to, or what. I have been talking to hundreds of owners, yourself and myself included, where my application's been in since March 22nd, and all I got back was one email that says, we received your application, it's currently going through processing, and literally 5 business days ago, I submitted for the advance, for the $10,000 advance, and they're supposed to pay that out in 72 hours. I've heard nothing but crickets. So I want to know if everybody's experiencing what I'm experiencing or not, or if I'm doing something wrong, but I would love to hear about that.
Justine shared that she submitted the EIDL last week and did not get paid.
Did not get paid. Yeah, and I submitted the EIDL on March 22nd, and I have not gotten it. So I don't know if anybody's been paid on that thing, to be honest with you. And I hate to sound like I'm a cynic, but my job is to push hard for the benefit of the business owners, private practice owners in this country, and push hard for the benefit of APTA, for our profession. And if we can share some of this information, I can repurpose it and push back and get that out so we can really push where the pain points are, so we can get paid. We need to get paid for this. This is painful. These offices are closed. So I need some help from you guys. If you could give me some of that feedback, that'd be great.
Dan said his accountant said that there was such a backlog of the EIDL applications, she's preferring to submit for the PPP.
yes, preferring, but my understanding is you are completely entitled to both. So I've been encouraging every single practice owner to file for both. I know the EIDL's got a longer runway. I know that. And because they're going to give you that $10,000 cash advance with no strings attached, I am going to be hard fast on asking every single one of you, do your due diligence, go through the online application, get it out there and get it processing. The PPP, it's a this week thing. Okay. So this brings us back to the question you were just asking me, Nicole.
Yeah.
You know, how do I move forward with my staff under this current climate? Everyone's filing for the PPP. My application went out today. Hopefully yours are today and tomorrow, as well as the banks are opening up their portals. So do you want me to, let me answer your question, or do I need to talk more about the PPP? Let me answer your question. Go ahead,
Yeah,
ask it again.
Oh, I already moved on to the next question.
Oh my gosh. I think you asked me about when is it best for me to bring my staff back, correct?
Yes, I did.
Okay. So one of the safest ways to play this, and there's multiple ways you have to navigate through this minefield, okay? And there's no, you know, I can't have one answer fit everybody's, you know, situation. But I'll tell you, if you could afford it and you can do it, one of the strategies I really encourage is, and it's a little late, I mean, this kind of happened in March, it really hit hard, reduce your staff by 25%, okay? Because you're still going to be eligible for the PPP because you haven't laid anybody off and all that stuff. And even if you did, you can still bring them back, and I get that. But I'm always of the nature of whatever it takes to keep your people gainfully employed, whatever it takes to keep their life as normal as possible for them. You know, I shot a video to my staff just a day or two ago, and I was just saying I have 48 employees, and I think out of the 48, there's 3 of us that are guys, right? I have like an all-female practice, and you can just see how dominant Nicole is over the top of me. Runs
That's
me.
why we're so strong. We're such a strong company.
You and I, we're like 2/3 of the whole testosterone in the group, right? So I was just saying in my video that I wanted to acknowledge the unbelievable juggling act and strain and challenges that my professional women are confronted with on a day-to-day basis, having to, you know, handle their husbands. And yes, husbands do have to be handled. They're just bigger boys, right? Handle their children, handle their household, handle their jobs, their career, their professionalism, the economy, the food, the protection of not letting your children or yourself or your spouse come down with this virus. I mean, you got to take your hat off. I mean, not me, but those of you, you got to take your hat off to what women are doing. They are doing all the heavy lifting, in my opinion, just my humble opinion. And there's I mean, guys, we do definitely have a role to play, but this is a daunting situation here. So that ties me back to why I would do everything possible within my power to keep my staff gainfully employed, reduce them 25% down to 75% of total, keep them there as much as you can. If you can't, you furlough them. They're still employed. They're going to get paid by the government. They're on a temporary layoff. That's the definition of a furlough, temporary layoff. Now, they're still going to be available to come back. So here's what's going to happen. If things don't turn around in a very timely fashion, we're going to have another crisis in about another 60 days. Because here's the deal. The government's going to fund this PPP supposedly in the next 14 days. All the applications go out this week. Everyone's going to get checks dropping in the next week or two, let's say. Let's hope it's even quicker. Now you're going to have money to pay people for doing almost nothing, because there's no way your caseload is going to turn around that fast, but you're going to do everything you can to reshape your business and restructure it. Well, by the time that money runs out, it's going to, hopefully the virus will flatten the curve. Things will start to move in the right direction. Well, now you have all these people who are full-time, but you're going to probably have 25% of the workload for them at that point in time. Now, what do you do? Now, do you lay them off again? I mean, where are you with this, right? So I'm suggesting that you bring your staff back to the scale that allows you to be in the parameters for forgiveness within the PPP, which is 75%. Carry them longer with the PPP money. Carry them longer with the EIDL money, because the turnaround is probably going to hit its nice runway a little bit later than June, right? I think it's going to be a little bit later. Nobody's got a crystal ball, but I'm thinking it's a little bit later in June. So here's my answer. Prorate the staff members that you're bringing back. Professional staff first, because they're the highest income earners, most likely of their household. The hourly staff are equally as important. No human being is more important than another. A life is a life, a person is a person. But their hourly unemployment benefits are going to be unemployment at full plus $600. Can someone correct me on this? Is it full weekly pay plus $600 a week, or is it full monthly pay plus $600 a month? I keep losing my thought on that. If anybody knows that, could you chime in? I want to be able to say that right, but I do know it's your
weekly. According to Ronald, says weekly.
Weekly. So whatever your full pay was weekly, if it was $800 a week, it's now 800 plus 600. Nicole, I will not ask you to do that math. That's 1,400, right? So that's going to be what these people are going to get who are hourly. They're handled. They're pretty well handled. Get your professional staff to wear more hats, handle more projects. And Daniel is in a perfect position to help you get your policies, procedures, your compliance issues in. Clean house, spring cleaning, fall cleaning. Listen to my podcast tomorrow, because I am going to be talking about best practice models for your professional staff and what to hunker down on. And I'm going to talk about the way you can make the most of your staff's time with compliance, more environmental compliance related issues moving forward. So I'm going to be hitting that topic. So hopefully that'll help you. So hopefully that answers that question, Nicole.
Yeah. And Dan had a question. If I just hired a new grad PT prior to the pandemic, what benefits can I provide for him? Can he apply for unemployment with such a limited time working?
Ooh, that's good, because he hasn't really paid into the fund, right? So I'm under the understanding that a lot of those rules are being bent and twisted and waived. So I don't know, because I don't know what state they're in, and I don't know, the latest on that. But my thing is, if he was or she was full-time and they're furloughed, they should apply. They should simply apply. Okay. Now I know there's this unemployment sharing program, benefit sharing. I've looked into this from multiple states where you can keep them on part with you and part with unemployment, and they can get paid from both. That sounds great in theory, but I'm going to invite you guys to do the research I did. It's tough. It is tough. There was a lot of red tape. There's a lot of documentation with that. There is a diminishment of the reimbursement that they're going to get. It sounded great when it first hit my ears. I spent 5 hours doing some hunkered down work on it. I'm not a fan of that shared benefit unemployment program. Either let them get the unemployment or keep them employed at 75% or greater. I think you're going to do better by your employee by thinking more holistically in that manner.
Okay. Well, I want to wrap it up with that, because we do have a lot more other questions, and I'm going to reserve those for next week. I know we're running a little bit over, and I apologize. There's just so much information, and when we bring such smart people on board, to interchange with you guys, there's just a lot of stuff that we have to communicate. So thank you for bearing with me.
Wait, before you wrap it up, I know you got to go, but I have got to answer this question because I told them on Facebook I would answer.
Fine. All right. Answer that question. So one last one.
I'm like smack dab in your show here. I know. So you guys see how she's the boss? I told you she was the boss. I'm not joking. That's how it is. So I had this Facebook question, and it was, hey, Brian, is this currently a good time to go after negotiating insurance contracts and trying to get higher rates? My answer to that is no. And I think it's not, because my understanding, and Allie could chime in if she's still around, but if not, Nicole can chime in. Our understanding is that if not 100% of the insurance companies around the country have reduced their staff. So their manpower is greatly reduced. And now you're going to come in and ask for more money at a time in which everybody's being pinched. I don't think that's going to go over very well. Not a fan of going after that. Right, Nicole?
Yeah.
And I agree too. Most insurance companies, you're barely going to get through on the phone to even find out where you need to send a renegotiation request to.
Ah, there's Allie. Good. So there is such a thing as a renegotiation request, and you can submit that, and there is a proper day and time to do it. I do not believe this is the time. People ask me all the time, Brian, what do I do? How do I ask it? Look, you look at the year-to-year cost of living adjustment that goes to the Social Security recipients. Typically in this country, the cost of living adjustment is between 2 to 3%. You then look at the last time your rates were adjusted. I remember when I ran my clinic, it went 10 years and Blue Cross Blue Shield did not adjust our rates at all. Same. I went back to them. I filled out the application. I finally got a meeting with somebody and I said, look, by all rights, I'm entitled to the average of the cost of living adjustment over the last 10 years because am I living on an island? It's not like I live in Wisconsin where everything's practically free. I live in Maryland where things cost money. I can't give chickens for eggs and goats for gasoline. It's not working like that in my state.
Why would you give chickens for eggs? That's just ridiculous. I would keep the chicken and make your own eggs.
Chicken lays an egg, Nicole, and I do know that for a fact. So you guys get the sense that our company is very institutional. We're very playful. We have a lot of fun because there's no point going to work if you're not having fun. That's another little culture thing you guys should embrace in your practice. But anyways, if you're going to go for that negotiation, I ask for 1% per year from the last time of adjustment. And that has always been perceived and received very favorably. And I've always gotten my adjustment when I fought for that. Does anyone have an example of a presentation to give with that carrier? Nobody should have an example of a presentation to give because it's individual per carrier. You got to look at who you're talking to. What I'm saying to this one in this state is different than what I'm saying to that one in that state. So really think about, and if you've expanded services, you want to put that into it. You know, we're caring for pediatrics now, or we're doing women's health now. We're doing things like that. So, and then last, and this is Nicole's show, so I told her I wasn't going to run away with it. So I want to really, really, really ask you guys to think outside the box as to what you can do to be the best human that you are. And what do I mean by that? I believe we owe it to ourselves to dig deep at this time when so many people are hurting and so many people are in need, in greater need than us, and find ways to give back to your family, your friends, your employees, and the people within your community, whether it be referral sources, old patients, patient database, or just the raw public. It goes a long way. It says a lot about who you are in your character. I know for us, I said to myself, ever since Friday, you have the whole administration going and saying, we have to wear these masks out in public, which not just optional now. We really need to do the distancing. We really need to. I immediately sourced a place where I could get 2,400 masks. And I contacted every one of my employees and said, I am going to drop ship masks directly to your house so you can protect your family and your children and one another. And what else can I get for you and send to your house so that you know I'm caring for you as a team? Now, I'm not saying do what I did, but I'm saying think about it, right? If I have anything left over, the next thing I'm going to do, and the next thing I'm going to ask you to do is contact the top medical offices that you have relationships with, contact the top charity groups that you've serviced, whether it's the Moms Book Club, the Moms with Multiples, it's the, the Arthritis Foundation, the MS group at your local hospital, and see how you can give them some protective equipment, some PPE, because they're in your community. And if we don't protect each other from contaminating one another, you're just harming your community. So if you have any means at all, that's my message here. I'm going to talk more about environment. And here's where I would recommend you go. And I'm going to end with this and give it back to Nicole. Contact PT United. We're going to have the link up here. That's who I went to. I looked all around who could help me. Quinn is the owner of PT United. Keith is the gentleman there who helped me get what I needed. Masks, gloves, sanitization wipes, sprays. I mean, these guys really came through for me to help me do what I need to do to help my community, help people I love most in my inner circle, because life is all about who you choose to spend your time with. So that's my message for you guys. Thanks for tuning into our Zoom live chat. I hope this is helpful for you. I hope to give you even more information on our podcast tomorrow. So please do subscribe, and whatever you do, don't abandon the podcast for these Zoom chats. Nicole going wild on the popularity here.
I will tell you, and we did have more questions I really wanted to get to, but again, we'll wrap it up. Angela had asked about what type of training you can do. So Brian's going to cover that in the podcast tomorrow. Yes. That is something we touch on. So yes. We will definitely be giving you some tips for training you and your staff right now. So thank you guys all for your time, for listening. Daniel, special thank you to you.
Thank you.
You were amazing. And I think, tremendously helpful to our people.
Tremendous wealth of knowledge.
I appreciate it.
And putting up with our Wisconsin jokes and everything. Just really thank you. It never gets old for me. It might be getting old for everybody else, but
never.
Thank you, Nicole. Thank you for having me. And just remember, to Brian's point, if you do sadly have to furlough your employees, please do not contact them while they are on furlough. Do not give them work to do. That's not allowed. So just once again, it's a challenging time. We're all having to deal with this. So it's okay to reach out And thank you very much, Nicole. Thanks, Brian.
Thank you,
All right,
Daniel.
perfect.
Hi, guys.
Thanks, guys.
Just to remind everybody, the recording will be live tomorrow in your emails as well as social media channels. And like Brian said, look out for the podcast tomorrow on our
Can you
website.
put the podcast link up too? We just got a question about the podcast.
Yeah, so I'll
That'd
put
be
the
great.
podcast link in the email tomorrow in our replay
Perfect.
email so people can have that.
Keep that
Okay, great.
50,000 downloads going, Nicole.
Yeah.
Been on my heels.